Hello, Facebook and friends and family and our patients of pediatric partners. My name is Dr. Peter Carter, and I am here for our weekly installment of our Facebook Live sessions that the doctors and I here at Pediatric Partners in Overland Park in Olathe, Kansas are doing to help educate folks just on some cool pediatrics information and stuff that we talk about a lot, as well as some COVID updates. And these things are blowing up the internet, so jump on. Just kidding. We're having fun with it. I think we're teaching some things, and I think some people are getting some good value out of this. So we hope that you will get some good value out of this presentation today, as well as keep an eye out for our upcoming presentations each week as we are rotating through different topics. Jump on there and see what's going down. We're also starting to do, for those baby or parents that are expecting babies, a few of our prenatal visits kind of in a group Zoom type setting. So keep an eye on our website for those as a great way to learn stuff about what to expect from our office, and just as you're having maybe your first or second baby or you're new to the area, we'd love to chat with you, and it's a little more private and kind of small group setting to have some of those questions hashed out live time as well. So today we're going to be talking about some questions. I'm entitling this Top 10 Baby Questions that I get from parents, and kind of focuses a little bit on the newborn period. Kaylee, hey, thanks for watching. Hope things are great with you and your family. The top 10 questions that we get, and it's a lot of newborn stuff, a lot of first couple months, but some of this spans the first year of life. And it just kind of will hopefully, relieve some anxiety, some fears for those of you with babies, or for those of you expecting, or, just reminders of things. Okay, yeah, that is normal, or okay, I do need to worry about that. And especially in light of COVID, where if you read the internet or if you watch the news, every symptom that you have is COVID until proven otherwise. We know that's not the case, but we do know that COVID is real and very dangerous, and we'll talk a little bit about that and maybe some more updates about that toward the end of the talk. So I had intended to have these wonderful little flashcards to do a countdown from 10 to 1, like David Letterman style, from the Tonight Show, whatever show he used to do, and have my kids color them or something. But I'm gonna say hashtag COVID, it just didn't get done. So we'll just do a boring countdown. So these are in no particular order, but maybe we'll just go question number 1. We'll just go from 1 to 10. So I get a lot of questions about rashes and about baby skin, and I think all pediatricians do. And a lot of the rashes that happen in the newborn period are very, very normal. The baby goes through this wonderful womb where they're in this perfect pH balanced, liquid in mom's womb, and then they're born and they're exposed to so many elements of the world. Just the air that they're around, the sheets, the clothes that you're wearing, your skin, all that stuff is different for the babies. Hi Sarah, thanks for watching. And so skin changes, and then there's also just some normal newborn rashes that happen in the first few days just because they happen sometimes. And so I'll tell you that all the pediatricians that I know, especially those working here, are doing an amazing job of looking at your skin of your child every day, to make sure at those checkups, to make sure everything is normal, and in the hospital, and then also once you go home, we're watching those things. Some skin rashes that are just little red bumps here and there, probably nothing to worry about. The first couple days, some babies get these little kind of red little bumpy rashes. They're more like that size, I guess, just small, a centimeter or less often. And then there might be a little yellow head at the middle of that, and you're like, oh my gosh, does that look like it's a pimple or a pus or something? And usually that's this, I always say it's a normal rash with a fancy name called erythema toxicum, neonatorum if you want to get official, but it just means it's like normal newborn rash is what that means to me. So nothing to worry about. Babies get splotchy a little bit. They get kind of purple hands and feet at the beginning as they're not getting quite as, robust blood flow to those ends of their extremities, because they're just not as vital as the heart and the lungs and the developing liver, etc. So all that's pretty normal. And then as they get bigger, they, just as they're exposed to different things in the world, different detergents, they have more little blemishes, and those are mostly going to be normal in the first many months of life. I will often remind parents that the weeks like 3 to 6 period, sometimes even longer, a lot of babies get a little neonatal acne or newborn acne that's kind of this bumpy textured rash that sometimes is on the forehead, kind of down here in the neck or the chest or on the back, and it looks kind of weird on some kids, and including one of my own children had some. I was like, oh, that's pretty good rash. But the good news is most of that just goes away on its own. There's nothing you really need to do for it. Vaselines and lotions and stuff, if it makes you feel good, you can do that, but oftentimes it's not necessary, and sometimes make clogged pores and make it a little bit more I don't know, exacerbated, but this depends on the kid and how they respond. So watch for those things. Certainly in the first year of life, any sort of fragrance-free lotions and soaps and detergents, all those things are helpful to skin to decrease the chance of rashes. Even, those wonderful lavender scents. Randy Floyd, shout out. Midwest Anxiety guys, check it out. They do some awesome work for kids. And Randy does awesome work with kids, and his team does there as well. So definitely just kind of keep an eye on rashes. Avoid those kind of things that may irritate the skin more. If one detergent seems to be making it worse, try a different one for a while. And the whole family's clothes, because as you're snuggling that baby, your clothes might have been washed in a different detergent than you were washing your newborns in, but kind of make it all that fragrance-free, free and clear kind of stuff that's out there. So just be aware of that. Another question I get a lot, the first several months of life. My baby has the hiccups. Doctor, what do I do? Don't worry about it. It's just kind of a natural reflex. It's something that happens. This is number 2. Forgot to do the big formal. This is number 2 question. Hiccups, and they'll come and go. Really nothing to worry about. Certainly if it's during a nursing attempt or trying to do a bottle for your baby and you wanted to take a breather while that baby was trying to feed and let them kind of hiccup it out for a moment and kind of get back to a normal breathing pattern to decrease the chance of and kind of, sucking milk in or aspirating it into their lungs, then you could do that. I would say most of us don't see a lot of hiccups causing a lot of, aspirations or problems with feeding. So just be aware that, hey, it's pretty normal. All right, number 3, loud breathing at night. I get this question a lot, and having had my own 2 babies, I understand why, because it sometimes is different and weird at night, where your baby that's kind of calm even when they're sleeping and breathing comfortably throughout the whole day, and then at nighttime they might just get louder, and they're a little more, I usually kind of do in the clinic a bulldog, like, and the parents go, yes, that's it. Or sometimes there might be a little bit of breath holding or something in there. Most of the time that is going to be normal as well. It's hard to exactly understand why. Sometimes there's less humidity in the air, or sometimes they're just drier. They're not taking time to wet the palate as much. Sometimes the structures in the back of the throat and the nose might kind of just relax even more, so they're a little heavier, so they kind of make a little bit of more reverb and sound. Sometimes kids need to sneeze or just do that, but they haven't done it for a while, so it sounds louder as the breaths are being had. So most of the time I say don't worry about it. Certainly if they are doing some sort of pattern where they're breathing super hard and fast continuously for an hour or 2, then that would be a little unique, breathing more than at least 60 breaths per minute. But that would be more something we'll talk about later about as far as when to worry about a kid is sick. Sometimes if it's just colds, that may cause them to breathe a little bit more noisy. And little kids get colds a lot, as we talk about often in pediatrics. And so sometimes just doing a little bit of time in the steamy bathroom, that can be a nice thing, just to kind of help, kind of thin some of that out before they go to bed. Just hold your baby, turn the bathroom shower on hot, and close the door and let the steam kind of build up. So that's a easy solution. Sometimes saline drops to the nose can be helpful. Sometimes another thing that babies may be doing at night is they're just grunting as they're pooping. And oftentimes parents will say that they get really grunty and they put their knees to their chest, and then they poop and they feel better. And I say, yeah, that's great. That's exactly what they're doing probably. Probably nothing to worry about. It's very normal. And so, sometimes kind of massaging their bellies pretty deeply, or kind of cranking those knees into their chest to help them kind of facilitate getting that pooping out. That can help them because they can't coordinate that very well when they're little. And this isn't just newborn. This kind of goes for that first year plus of life, as they're trying to figure out how to get bowel movements out and kind of just be healthy and normal there. So a next one, kind of related to the gastrointestinal system, is spitups. This would be question number 4, is about spitups. And we get that a lot, where babies are spitting up, and there can be a large range of things. Hi, Aunt Susie. Thanks for tuning in again. She's a proud grandma of a baby, so she's checking in on some things too. There are spitups that happen for various reasons. There's certainly, you go to the internet, you're going to think that your baby has gastroesophageal reflux or GERD, or some sort of other, obstruction at the end of the stomach. There's a fancy term for that, but most of the time it's just spitups. And some babies do that because they just eat a little bit too much, or they ate a normal amount and their body is kind of processing that food in their stomach, that milk, and it hasn't kind of processed into the intestines. And as they move their knees up to their chest really fast, there comes a little bit of spit up. So a lot of babies are just happy spitters. And so the babies that are gaining weight really well, that's why those weight checks are really important the first year of life, to make sure, hey, with the spit ups, is your baby maintaining their weight? And if they are, and there's other healthy things going on, a lot of pees, a lot of poops, then we go, oh, this is pretty healthy and normal. So that's reassuring. If a baby is, having huge vomits every single time and they're losing weight, we'll talk about ways to kind of get through that to see if it is reflux. There's some techniques we can use, from probiotics to other antacid medicines to enzymes, and some different, mechanical kind of techniques to kind of talk about keeping baby upright for a while after feeds that are often helpful, and maybe even allow you to avoid any sort of medications when a baby has reflux. I always tell parents that really every baby is born with some reflux, as the little sphincter at the bottom of the esophagus and the top of the stomach, it just kind of is just not really mature until closer to 9 months. And some of that is just babies are upright more at 9 months, which helps just with gravity kind of doing a trick to help that milk stay in. Spit ups that are green, like bright green, that's always scary. That's never normal. That's kind of a concern that needs to probably go to the emergency room, or at least call your doctor pretty urgently to talk about it. And then like bloody stuff would be worth at least a call to your doctor or an appointment to touch base on that to see how things are going. But a lot of the spit ups, if the baby spits up and then happy and then they eat again later and they spit up a little bit, sometimes watch the volume of your feed or the length of your nursing attempt, and you can shorten those or make the volume a little bit lower. And if it still happens and they're still happy, I don't really get too excited. I call those kind of happy spitters, and on we go. They smile and it becomes more of a laundry problem and changing your shirt or their shirt or clothes than an actual like anatomic baby problem. So number 5 question from parents. Number 5 is goopy eyes. And I've had this one a lot in the last 2 weeks, even more so than normal, but it's a common question that we get in pediatrics often. My newborn babies or my 2-month-old baby or my whatever baby's eyes are goopy and have some yellow discharge coming out of them. Now, we do get worried about goopy eyes, especially it's kind of a little bit of the subjective measure, but we will watch that in the hospital and other things. And we look at maternal history, some of the labs that were drawn for moms when they had the babies, and kind of get some history, if there's any kind of exposure risk for the baby for certain diseases that may have been passed through the birth canal. So that's really important to know. But a lot of babies will have a little bit of yellow goop in their eyes and their crusty lashes after they wake up from a nap or between feeds. And the whites of their eyes remain normal. There's not redness or pink kind of in the outer or the inner part of the whites of the eyes. And that may just be something you've probably read about or heard about called lacrimal duct stenosis, or just kind of a tight or clogged tear duct. It's kind of a normal thing for babies to have smaller tear ducts, and as they get bigger, those expand and they're easier to kind of just drain and kind of help with draining. As they blink, more fluid comes through there that helps them drain better too. So a baby that's been sleeping for a while often wakes up and they've got crusty lashes. So generally, all you need to do for those is take a warm wet washcloth, kind of rub the inside of the eye in here and kind of wipe away, and just do a few passes like that. We always encourage you to, if you're going to do both eyes, to use a different portion of the washcloth or a different washcloth or something of that nature, just in case it's an infection, you're not spreading it to the other eye. But if you have a red eye that's kind of persistently red and it's just lingering there, and then that might be worth, for sure, a telemedicine visit if you need to, or a visit in the office for us to take a peek and decide what's going on. Sometimes we'll even culture those things and send them to the lab to know what we're treating. But there's definitely some things that we can do to take care of those. I also remind parents that just like you and I, sometimes you may itch your eyes and your friend may say, "What happened to your eye?" And you're like, "Oh, I'm fine. I just itched my eye a minute ago for whatever reason." Same thing with a baby. If their eye looks red for 10 minutes, but then it's white, half an hour later, that's not an infection generally. So that's a reassuring thing to me. But if it's kind of red and it's been like all day, it's like bright red and pink and it's oozing, follow up with us. So, all right, number 6. The number 6 question that I get about babies is about stools and transitioning. Like, what's going on with the poop, doctor? And it's a great question. As boys, we talk about poop all the time, just growing up with brothers and stuff, and so we always find it funny, but sometimes you just talk about these things. And we even have poop charts here for the big kids. Looking up in my cabinet here, where we talk about poop a lot in pediatrics. So it's something that is a great question. We literally have charts that we kind of show you some things as kids get bigger, because we have these conversations a lot. It's kind of a part about being healthy. So babies have those big hard meconium stools that are kind of thick and like clay-like and Play-Doh-like at the beginning. It's really sticky and almost like tar. And as babies get more milk in them, they will transition those first few days even to kind of having more kind of firm brown stools. And then eventually, a lot of times breastfeeding babies get kind of this yellow, hi Abby, thanks for watching. They get kind of this yellow stool that has some seed-like stuff in there, and that's pretty normal. But my take home for poops is most of the time poops in the yellow, brown, green category are all going to be normal. So even as a breastfeeding mom or even a formula feeding mom with zero changes to that formula, their stools might have a little bit of variance just for different reasons, and that's probably okay, even if the color changes slightly. If any sort of baby has like bloody poop kind of consistently or something like that, or really just major changes, then we'll want to talk about that more on a one-on-one kind of visit basis. But a lot of the stool stuff can be pretty normal. The number 7 question from parents that I get is just questions about sleeping. And I'm going to focus a little bit, especially the first couple weeks of life. A lot of parents are worried that their baby is only awake at night and that they sleep during the daytime. And unfortunately, that's kind of true for a lot of families. And the way I think about this is their sleep cycles are kind of set up even in those last couple months of pregnancy. And about 100% of moms I've talked to, including my own wife, will say that, boy, those last 2 months of sleeping when you're pregnant are awful, because you're walking around all day and the baby's kind of, I don't know, it's kind of like riding a little ride in a hammock and kind of get a nice kind of soothing walk and jiggle and jostle. And then a mom, heaven forbid, she tried to like get a nap for a minute and take some rest at night, and then the baby wakes up and kicks them all night long. And so they're kind of almost reversed as far as when the timing of when their bodies have been awake. And so it takes a while for that kind of to twist and get back into normal. So having lights on during the daytime is great. Having the windows and blinds open during the daytime for a newborn for the first couple months of life is great. Even if they're napping, they'll often nap right through that. It's okay to set your baby down while they're napping during the daytime. So if they're always held and then the only time they're not held is at the evening when you're trying to sleep, that will feel different to them. So it's okay to try to set your baby down some and not necessarily always have a parent or a grandparent or a helper holding them and snuggling them, because they all love that. There's nothing wrong with that necessarily, but it just may help them get to a little bit better sleeping at night eventually. And so at nighttime, kind of try to keep the lights dim if you're waking up, or when you're waking up, because you will be every 2 to 3 hours to feed your baby often. Then keep those lights dim. Try to stay off like big flashing lights like your phones or TV, because that may kind of stimulate the baby and kind of have their brain be a little more alert and have a little bit more struggles falling asleep after that nursing or that feeding attempt. So keep that in mind, that can kind of help, and that will just take some time. So just keep doing your best. I tell every newborn family that the best thing they can do is try to rest between every feed when they can, because you just never know when the next one is going to come. And believe me, it's exhausting. Having lived through it and just watching families do all the time, that first month especially, it's kind of like, what just happened? But you'll get through it. I promise you will if you're in the early stages and watching this. That it will get better, and keep using your support person if you have one, or support people, whatever it is, to kind of guide you through that, and just ask for help if you need it. That's allowed and encouraged. So, all right, sleeping. All right, number 8. So the number 8 kind of most common baby question that I get is babies, especially the first month to 2, of quivering lips and like hands that kind of do this number when they're out of their swaddle, or when they're held, or being moved in a way, or having a diaper change. There are some things with quivering and kind of those things that make us think of jitters, which makes doctors worry about low glucoses or some other medical reasons for it. But a lot of the times in very healthy babies, that is just kind of normal newborn reflex stuff, nothing to worry about. And so when a baby is kind of unwrapped and they do this, or if they have been feeding or removed and their lips quiver really quickly, those are often things that they kind of resolve. That's a good sign. Just doing this for a second does not mean that the baby's having seizures, for instance. Especially if you're able to kind of take those arms and kind of put them on the baby gently, and they kind of stop. That's always a reassuring thing. If a baby's just continually jerking and going on, then that becomes more of an emergency. Even if they're kind of held and it's not able to stop, it's continuing. That's concerning. So, but those little quiver lips and jitters are pretty normal. All right, so The other things we're talking about here, let's go number 9. So the number 9 most common question I have is, what about visitors? This becomes even more pertinent now with COVID here, and we'll talk kind of this topic and also number 10 about that a little bit. So visitors are entirely up to you. So in the hospitals, most hospitals are allowing mainly like one support person. I, of course, if you're pregnant and watching this, encourage you just to touch base with your hospital where you're planning to deliver and see what their rules are, to make sure that you're kind of abiding by those rules. And then once you get home, though, it's kind of up to you guys and what you feel is best. So at the beginning, obviously, anytime you have a newborn baby, even without COVID around, wash your hands for all visitors before they handle your baby. If somebody has been sick or runny nose or has a fever or I just don't feel right, I feel kind of achy, boy, tell them you love them. I joke with my parents all the time, like tell them to bring over a casserole and sit on the doorstep. Maybe one they didn't make themselves, but maybe bring a meal from somewhere else, or come mow your lawn or something like that if they felt good enough to do that. But maybe don't come in and like hold your baby and snuggle and breathe in their face as much. But if they're healthy and well, then you guys kind of get to decide. And some families are asking grandparents or aunts and uncles or whoever it may be, nannies or whatever, to kind of quarantine for a few weeks before baby comes if they need to help with the bigger kids or just with the baby, and quarantining or isolating for a couple of weeks. I think that's a great idea. I had one family who was kind of creative, like back in March. They're like, we're thinking about just doing like the adult zipper snuggie kind of things, like the one piece pajamas, and like we're gonna have the grandparents help a little bit, but we're gonna make them wear that. Is that weird? I was like, I don't know. I mean, it's not crazy. Just to have some sort of kind of more clean outfit that is clean, hasn't had any sort of exposure to anything from the outside world. But washing hands, I think masks are a must right now for some of the family members that may be helping out and kind of helping with the baby. I think that's great ideas to kind of, hey Christine, good to see you. Thanks for watching. So masks are a good idea, but hand washing, masks, and just kind of keeping an eye on where people have been or where they're going and what they're doing, as far as keeping those visitors kind of minimal at the beginning the best you can. But ultimately, mental health is important in all of this, and so getting the support where you need it and finding a balance there, and basically you as parents get to decide what you're comfortable with, and if having those conversations with your family members and being cautious about that is important. As always with visitors and newborns and really the first year of life, I encourage all people who are going to be around the baby a lot to get a flu vaccine. So that's coming up here in September. Probably we're going to be getting flu vaccines. And then also their Tdap boosters, especially that P on that Tdap is pertussis, and that helps prevent whooping cough. So we want to do that for all family members that have not had that recently, and talk to us or your OBs about that if you have concerns. And I'd say the number 10 most common question is, what do I do if my baby's sick? And so this is kind of the last thing we'll talk about here today is, what do I do if my baby is sick and acting weird? And what does that even mean? How do I know if my baby's sick? So the first couple months of life, a sick baby makes us kind of worried. And the literature is still developing on this, even though it's been around forever. We're kind of wondering, what is actually best? And there's even a lot of newer recent articles about this as people are in the academic world are kind of trying to find out, how worried do we need to be if a baby has a fever and these kind of things. So the things we usually tell parents, if they have a fever, a baby has a fever either in the armpit, take it under here, don't add a degree, just tell us what the temperature is, or in the rectum, going in just a small bit with your thermometer of 100.4 or higher. If they're breathing really hard and fast, kind of like they ran a marathon for an extended period of time, they're breathing that way. Or if they're just acting weird, like you can't feed your baby for, for hours at a time. You've tried 2 or 3 different times over normal times you'd feed them, and they just don't move, and they won't wake up for a feed. That's concerning. So we get worried about urine infections, we get worried about blood infections, meningitis, which is a brain infection. Those things are all super scary to pediatricians, and we want to treat those fast if we think there's actually a problem. That way we can give your child the best chance to have a normal brain and a normal development and everything else as they get bigger, because those little baby infections can have long-term implications that can be pretty scary. So luckily we don't see a ton of it because of our cautious nature, but just want to educate you to look for those things. Those are kind of the things that we tell you to look for routinely, whether it's COVID time or not COVID time, that 100.4 or higher. Especially, again, the first 8 weeks of a baby's life. We get a little less worried at 8 weeks, and then there's even a little bit of a gray period up to about 90 days of life where we're so kind of a little cautious on what to do with babies, and we're probably erring on the side of, a little more evaluation versus less. But that first couple months of life, if a baby gets sick or has any of those concerns, we're probably going to say, we love you, but go to the emergency room. a pediatric emergency room preferred, where they're used to handling babies and drawing blood and getting urine and maybe even considering a lumbar puncture of the spine to look at spinal fluid to see if there's any infection signs in that. So that's why it becomes a big deal to kind of worry about visitors and worry about washing hands and all those kind of things, and not going to the grocery store a bunch if you are able, and definitely not bringing your baby out right now to the grocery store. Kind of have somebody else do that for you, especially at least not having the child with you. So with COVID, just continue to kind of just do your best. I think we're seeing here in Johnson County, a lot of you have probably already seen some of the stuff from the governor and just the numbers that are coming out, that the cases on the rise here as well as many, many places in the world. So I just keep challenging all of you to do your part, to limit your extra exposures, limit your extra travel, limit your extra trips to whatever, keep your gatherings kind of small or outside, or socially distanced the best that you can. Keep washing hands like crazy. I think the governor recently, I think it's going to be the Wednesday after Labor Day now that schools in the area are planning to open at the earliest. I know there's at least one place I heard of today when I was at the hospitals doing rounds, that they have gone virtual for the entire fall semester, and I wouldn't be shocked if some of that happens here. But if we can kind of work together and get the numbers down, the plan was about, it's basically, this 14-day quarantine we've been hearing about, where we kind of can make the numbers drop. Doing that 3 times is the goal before school starts. But then we'll have to stay diligent and continue just to kind of do our best to keep this curve as flat as we can. So I encourage you to do that. Anyway, that's the top 10, Dr. Carter's top 10 baby questions answered here live. Hopefully you found something that you can utilize in your daily life with your kids. We just keep encouraging you guys to ask questions at the visits. Certainly use our website. I give so many shout outs to Dr. Stuppy all the time about the amazing amount of time and effort she's put into keeping our website up to date and full of amazing, valuable information for parents. Find a great book like A Baby 4-in-1 that has a lot of interesting information for the first year of life, as far as just quick little reads of, hey, I got to poop. The baby has to poop and change. What does that mean? Great. The baby is doing this and they feed. A lot of those answers are either on the website of that book or other books that might be out there. So keep learning. Keep learning about your babies. You guys are still the best people at knowing exactly what's going on with your baby, because you're with them all day long and snuggling those beautiful little boys and girls of the world. And we love taking care of them and learning about them alongside you. But I'm always here to help and answer questions too. So keep asking questions, stay well, and I look forward to seeing you guys next. And send us information if you guys have questions about any specific topics. We're always looking for the next topic idea. Obviously, for a while, we'll have some COVID information in a lot of these. Hey, Tracy, thanks for watching. Watch for any information that's coming, but give us information if you guys have some thoughts or questions, and that way we can kind of address those on certain topics as the next Facebook Lives come out. So hope you guys have a fantastic rest of your week and a great weekend. Stay well, give those kids hugs, and all of you guys be well. Thanks.